Hey, this is Doug Field, CEO of the Institute of Healthcare Consumers, along with my co-host Brent Macy, Managing Director, and welcome back to this segment, Healthcare Consumers and Radio. Kind of continued discussion on all the different moving parts. We're going to take a look at, the whole health assessment and wellness side of the equation. Joining us today to kind of lead this discussion with us is founder and CEO of BioIQ, Justin Bellante. Justin, good morning. How are you?
Good. How are you guys?
We're great. Hey, good to have you on the program. Haven't seen you in a while. Great to have you here.
Yeah, it's great to be here.
Yeah. Justin, give our audience a background on BioIQ, and then we'll kind of take a deeper dive into some of these other areas.
Sure. BioIQ is a healthcare technology company. We were founded back in 2005, and we specialize in connecting people and populations with solutions to measure what matters most. Typically that includes things like heart disease, diabetes, hypertension, risk for certain diseases or conditions, with the ultimate goal of, creating awareness and helping them achieve their optimal health. And I guess maybe what that means for employers is, that's connecting employees with solutions to conduct biometric screenings, other types of health assessments, track their incentives, and beyond that, for health plans and ACOs, that means engaging and connecting their population with solutions to close gaps or improve HEDIS or STAR ratings.
Yeah. Justin, everyone, kind of the hot topics right now is everyone's talking about mobile, everyone's talking about wearables, and those can be two of the same or different discussions. Where do you see what do you see the impact of mobile wellness being near term and then long term?
Yeah, well, I think it's as healthcare has evolved, we've definitely seen really over the last 8 years an increasing emphasis on experience and usability. And mobile is one of those things that really improves the user experience. It makes it easier for people to connect with healthcare solutions, to get engaged. And it's also one of those things that addresses kind of an ongoing need we see is just access. So it makes it easier for them to access the healthcare system, whether it's, from our perspective, things to help them measure their health, or ultimately giving them easy, convenient access to their results or information on what to do next after you've had some type of measurement or gotten your results.
Yeah, as we all sit here with our mobile phones within arm's reach, right?
Exactly.
Tell us more about what you specifically are doing with mobile.
Yeah, so from BioIQ's perspective, it's we've focused on when we connect a population with solutions to measure their health. Typically, we're connecting them with the ability to conduct an on-site screening, go to a local lab or a retail pharmacy, go to their physician, or to send them an at-home test kit. So we're really focused on giving them access to a lot of kind of convenient ways to measure and understand their health. So mobile for us is a tool that allows people to basically anytime in their daily life at their own convenience to go on, open up their phone, schedule a screening, find a local lab or a retail pharmacy even as they're out and about during the day, or order a test. And then as a result of that, also to be able to, once those tests or screenings are conducted, at any point in time to be able to view their results, to see those results integrated into an assessment, to get an understanding of how those results might impact an incentive program that they're in, and to see next steps. So it's really just kind of taking the existing platform we've built, and as you said before, just making it convenient, putting it in the palm of their hands.
Yeah. Justin, this is Brent. So just so I understand, with the employers, they would need to have their populations download an app onto their phone that then allows them to get into this platform and utilize it. Is that correct?
It's a great question, and it's we decided not to go the route of a native app.
Okay.
I think that's becoming less common. Really, what we noticed looking across our population is in the past about a third of our users were accessing our platform online via smartphone. So our goal was really to improve that experience and create basically a technology platform and a portal that's optimized for mobile devices. So it's really kind of a web-optimized site as opposed to a native app on the phone.
Now, I'm assuming there's the dashboard for we, the employer, too, right? That simulates all the data and makes it accessible to the employer?
Exactly. Yeah, and that's kind of been one of the hallmarks of our programs is we not only focus on the experience of an employee, but as you said, focus on the experience of the employer and the administrators of a program, and that's kind of giving them access to real-time data and real-time dashboards. And of course, those can be accessed on any device, whether it's an iPhone, iPad, or a laptop.
Justin, if I'm a health plan out there listening right now, is there a value for me in this solution? Are you talking to health plans about possibly integrating your product with theirs?
Yeah, it's a great question. There's really two avenues from a health plan perspective. One is, bundling this solution with some of their other wellness and behavior change solutions. So using this platform as a way to engage people, connect them with solutions to measure their health, and then the health plan provides a lot of the infrastructure for interventions or next steps. The other thing we're seeing within health plans is, increasingly using these types of tools to engage their, Medicare and Medicaid populations when it comes to, getting them engaged, getting them compliant with best practices in screening and health measurement, ultimately with the goal of improving, kind of HEDIS ratings or star ratings.
Justin,
so really it's kind of twofold from a health plan perspective.
Can the same be said for the opportunity for what you do to be done in conjunction with some of the traditional, what they call the traditional population health companies right out in the market today?
Yeah, I think, really, across the healthcare spectrum, I mean, we see a general need of just getting people engaged, making it easy for them to measure their health, and then, ultimately to manage that data. So once you've created awareness of a condition or a risk, getting that data quickly integrated into a next step, whether it's a nurse call center for follow-up or into a health assessment or any of the interventions that we see across the healthcare spectrum. And in general, when it comes to measurement, again, we've been seeing a real increased emphasis on that, just given the focus on quality. And as we're trying to measure quality, we're trying to measure outcomes. Of course, those are really based upon health improvement. So, it's been kind of a boon to us to see, a real focus on, fundamental measurement of health as a backbone for a lot of what we're trying to achieve in healthcare these days.
Excellent. Now, Justin, you talked about you're stretching across the whole healthcare space, and the one thing that we're seeing, and I'm sure you're seeing, is the emergence of these private exchanges out there. And Doug and I were actually at a panel discussion with three of the leading exchanges out there, and the one thing that they said is if they do not have a robust health and wellness platform within their exchanges will not bend the cost curve. So are you guys actively looking at the exchanges that are launching out there and having conversations with them about how you might work together?
Yeah, absolutely. And I think one of the benefits BioIQ has had is we really started kind of in the consumer space when we began the company back in 2005 and went from a consumer product and moved into population health management. So as we look at some of the private exchanges and the ways that they're looking to engage individuals, a lot of the consumer friendliness, the focus on that experience, it's really playing into those conversations for us. So, yeah, like you said, a lot of conversations and a lot of opportunity in that area.
Justin, we got about 2 minutes left on the program, and want to allow you to leave the audience with a couple good takeaways for what they need to be looking at when they're considering your solution and some of the challenges that they face within whether it's their employee population or their member population if they're a health plan, and then let our audience know how they can find you.
Sure. Well, I think one of the real differentiators, as we've been talking about throughout, is just a focus on the individual experience. And it's very difficult to get people to engage in solutions when it's not easy or convenient. So one of the things that BioIQ provides is a really consumer-friendly platform, an easy way of accessing a wide variety of options to screen and understand their health, and then comprehensive data management throughout. So to make sure at the end of the day, once you complete a screening, that data is getting integrated in real time into health assessments, health coaching portals, incentive dashboards, all the things you need to really drive behavior change and action from any participant's perspective. So to find out more about BioIQ, probably the easiest way is to go to www.bioiq, that's BIOIQ.com.
Hey, Justin, we really appreciate you joining us on the radio program this morning. I know it's early for you out there, and would love to have you join us at IHC Forum West if you think you can make it. Going to have a lot of good discussions around, some of the things we talked about today. And to the rest of our audience, we look forward to talking to you next week. Hope everyone has a great long weekend, and we'll see you next week on Healthcare Consumerism Radio.